And now I would like to introduce Dr. Rachel Davies. So Rachel is a chartered counseling psychologist with the British Psychology Society, and she's registered as a practitioner of psychology with the Health and Care Professions Council in the UK. She currently splits her time between working for the UK charity Relate, the UK's leading provider of relationship support, and she also runs an independent psychology practice which specializes in the psychological impact of physical health conditions. She has many other wonderful attributes and experiences, including teaching, researching, authoring a book chapter on systemic thinking in physical health in a core counseling psychology textbook, and we are very lucky to have her and her experience. So I will pass it over to you.
Thanks. Okay. Well, no pressure after that introduction. Okay. Yeah. As Jenna says, I practice as a counseling psychologist. I believe you have those professionals in Canada as well, and I work very often with families where a family member has cancer. And sometimes I see the whole family together, and sometimes the relatives will come without the person with cancer for all sorts of reasons, and that's totally fine. I mean, I want to say at the start, I was really pleased to be able to give a talk to you today and to share some of my experiences. I've been working as a therapist for about 20 years, and I've learned that actually every family is so different, and every cancer journey is very different, and I have a lot of respect for that, and you know, while I've got expertise and experience to share, I so value the learning I get from my clients and patients every day. So everything is different for everybody. However, I know that sometimes that difference can mean that you can feel quite isolated and lonely, especially as a family carer. And so what I'm going to talk to you about today is some common experiences and different ways that people have found to cope better with their relationships and with communicating in their relationships is the main focus. So I'm not going to give you any slides today. I know you've had some amazing presentations in this forum before, which have been obviously quite technical, and that's not what I'm going to do today. I'm not going to give you a theory-based talk, but I'm going to talk to you about the real experiences that I come across in my consulting room. The risk in doing this is that not everything I say is going to apply to all of you and your family situation, but I'm hoping there'll be enough that will hit home for all of you. I also want to say before I start that everything that I say is anonymized because of my kind of professional responsibility to my clients. And usually the examples I'm going to use, I've merged different cases. So you can trust that actually what I'm saying is real, but that I have protected anonymity and confidentiality of my my patients, and they know that I work in this capacity, so I have that in my agreement if anyone was kind of, you know, questioning that. So just before I launch in, just a quick check-in to say that I understand from Jenna that actually you often have people in your community who are sons and daughters or maybe brothers and sisters of people with pancreatic cancer. Now, it's interesting that in your check-in today, the people mostly seem to be caring for a partner or a husband or, you know, so maybe we've got more partners just here today just because how it is. So I've really shaped my talk around family members. And, you know, Jenna said about things for the future, there may be a more specific talk to do for you in the future about actually working with your partner as a caregiver, that we can look at maybe doing some other time. But the focus of today is that the person with pancreatic cancer is in your family and may or may not be your spouse. So the first thing I want to talk about is just how pancreatic cancer can change relationships and how to navigate some of this. We know that cancer is not just happening to an individual, that it impacts on not just the family members themselves, but how the family members then interact with the person with cancer. And I often think of it as like ripples in a pond. So when the stone goes into a pond, you've got the circle nearest to where the stone goes in, which is your kind of primary caregiver. And I'm guessing that the people who are here today are probably in that role. They are the closest relative, the one providing most of the care. But then, you know, you've got the kind of circles that go out from that when a stone goes into a pond. And I use that to sort of think about the ripples that cancer can cause through a whole family, and to friends and neighbours and colleagues and that sort of thing. So in some of this talk, I'm going to be talking about you and your relative with cancer. But some of the talk I'm going to talk about the wider family as well, and to share some thoughts about your interactions with them and the help you can get from them. When family members come to see me, the day-to-day challenge that they mainly talk about is about the shift from just being a relative, I use just in that kind of, you know, way, to being what I would call a carer. Now, notice I had a conversation with Jenna the other day. In the UK, we tend to use the term carer more than caregiver. I'm not so familiar with caregiver. So I might kind of dip between the two. So, but you know what I mean. We're on the same page with that. And what I noticed when I first started to talk to partners or adult children of people with cancer is that they often don't think of themselves as having a caregiver or a carer label. And they just feel that they want to just be the son, the daughter, the partner that they always were. And I think labels, my view on labels is that labels are only helpful if they get you something that you need. So if in the UK, actually identifying as a carer means you can have a carer's assessment, which means that you can have access to additional support. You can come to forums and groups like this. But some people really struggle with that. And some people don't feel it's okay to talk of themselves as a carer when they're with the person who has cancer. And I think that's quite common because the person with cancer may well be raging about having cancer or about deterioration or about the fact that they've lost some of their independence. And so if you go around sort of talking about yourself as being a carer or a caregiver, for some people, that forces them to think about their own situation more than they're able to do. So I know quite a few relatives who juggle that dilemma by identifying as a carer in their wider family, in their friend network, and connecting in ways like this, but actually they don't use that label at home when they're with their partner or their mother or whoever. The other reason that family members can struggle with the idea of being a carer or being a caregiver is that psychologically there's a large part of you that doesn't want to be in this situation. You know, this wasn't the relationship that you had. Wasn't what you'd signed up for. I mean, nobody wants, you know, cancer is not a gift that anyone would welcome. And so psychologically, there can be a part of you that still really doesn't kind of want to identify with that. And I'll give you a clinical example now of a woman, I'm going to call her Beryl, who I worked with. And she came to see me with her older brother, who had pancreatic cancer. And he had actually moved in with her as he was struggling to look after himself, doing his basic care. And he'd got more and more unwell. And Beryl was doing more for him. He deteriorated really quickly. But she said to me that she did this because he was a brother and because she loved him. He was her older brother. She idolized him. And she was really angry with me when I suggested that maybe sometimes she felt like his carer, not like his sister. And she said that he had always looked after her as the older sibling all of her life. And she couldn't get her head around accepting what she felt was like a role reversal, that she was now caring for her brother. That just didn't feel right. And I know that, I don't know if we've got anyone here today in this situation of caring for an elderly parent who is now ill, but I know that sometimes adult children say that as well, that you know, the way it's been has always been that the parent looked after them And then when you get to a certain point in life when that changes, that can be really, really hard. So accepting this label of carer or caregiver means you are acknowledging that things are different now in your relationship. And that not only things are different, but some of these differences are actually losses. And there are many losses that you are probably living with. Losses for your relative with cancer and losses for you. And some of the most common losses that people talk to me about is a loss of their own independence. Maybe you're having to give up work or reduce your hours, but also changes to absolutely every part of your daily life. So somebody said to me the other day that they felt they'd lost their ability to be spontaneous, or to be, they actually used the word silly. And the example they gave to me was that they said, you know, me and my partner used to drink a bottle of red wine as a couple. You know, that's one of the things we used to do on a Friday night or whatever. And she felt that she had lost that because she felt that she had to be the responsible one, like the grown-up in the relationship, and she had to keep a clear head. She may even need to drive somewhere in case of a medical emergency. So she'd lost that kind of, it's Friday night and I'm going to be spontaneous and that sort of thing. She felt that had been lost to her. Other types of losses that family members talk to me about is losses in the relationship itself. So the person that you're caring for is alive. So you have a marriage, you have a father-son relationship, whatever it is, but this relationship may feel very different. And sometimes it can feel that it's become one that is just carer and cared for. Some of you may have heard in the UK, we've got a large cancer charity called Macmillan. And I've done some work for Macmillan. And they ran a series of TV ads. You can probably look them up on YouTube if you're interested, about a dad with cancer is still a dad, and a sister with cancer is still a sister, and a lover with cancer is still a lover. And it was a very powerful campaign. It was based on some research that Macmillan did that showed that 85% of people with cancer don't want the disease to define them, and that the roles we have in our relationships are still really important. And it was massively powerful. And you know, families who had not been affected by cancer were writing in and commenting on this campaign, because they were thinking, I've never thought of this before. You know, that people with cancer are not just people with cancer, they are people who are still in all these relationships. It's kind of obvious to us because we're in the world of that, but to some general public it wasn't. It's a really good campaign, I think it is. And I think it's really accurate. So I see a lot of people in my clinic who are struggling with changes to what it means to be the dad, the sister, the partner, and working out new ways for the family roles you have to still make sense. So asking questions like, how can we feel like we're husband and wife and not just carer and cared for? And I think that requires a lot of thinking about, and that's the sort of work that I do with couples in therapy. What ways could you still be a daughter? Even if a lot of the mum and daughter stuff you used to do, you can't do anymore because mum is too sick. So I've got an example I had recently where a client was, her mother was very, very ill, was in and out of hospice. But she still used to call her mother for recipes and cooking advice when she got stuck. Even though mum was very near the end of her life, it was still the sort of thing she felt you would do with your mother. And it sounded like it was really important because all the other things that she used to do with her mother, like they used to go to Pilates together and they used to walk the dog together, they couldn't do that anymore. Mum was too sick. So she was trying to keep the parts of the relationship alive that they could still do in spite of her mum's illness. And, you know, you're probably doing these sort of things anyway, but if you're feeling that actually maybe, you know, you've let some of those things slip, it is really worth thinking about how can I recreate some of those things that were important that maybe have got taken over by the cancer. Some families actually notice that they're doing more things together, maybe having more quality time, because of the intensity of the cancer experience and the fact that they are maybe having to reduce work, give up work and whatever. And it might be really hard to think like this, but you are making memories by that quality time you have together with a loved one. And sometimes that can be really, I think sometimes people think making memories has to be very dramatic things and, you know, going off on holiday together and things that your loved one may be too poorly to do. But, you know, it can be, you know, feeling the sun on your face and having a cup of tea out in the garden. You know, it can be the simple things. Sometimes the simple things are actually the big things. And sometimes being the partner and the relative first and the carer second might mean that you have to sometimes shift the way that you think about things. So it might mean that sometimes you have to sacrifice a little bit of caring in order to be the relative. And you know, a day-to-day example of this would be, you know that they have their medication at 4 o'clock and you're the one who gives them their medication, but actually you're sitting on the sofa, you're watching a film together, you're holding hands, you're having a moment, it's all nice. And actually to jump up at 4 o'clock because, you know, the alarm goes off and you have to give the medication, to sometimes let that run and go 15 minutes over, you know, it's not a life-threatening situation, but actually that's value in the relationship, to actually be able to say, no, I'm just going to stick with this now, and just, you know, we're going to be a bit late today or something. So one of the things that can get in the way of this kind of trying to build up quality relationship time that I'm describing is just the emotional impact of what you are feeling and what you're going through. So I'm going to move on now to talk a little bit about 3 tips that I regularly look at with people that they have found helpful, and I've built on these tips because people are finding these useful. So I'm into another section now, Gemma, for knowing where I'm at with things. So I'm dealing with emotional impact. So the first thing that I would say can really help is not to fight the emotions, that they're really normal. I've never in 20 years spoken to a family member who had an emotion that didn't make sense when we actually talked about it. When I learned about their lives, when I understood about their relationship. This doesn't mean that some of the feelings you have are comfortable or easy. I'm not saying that at all. But it can be that actually those strong feelings really, really make sense. And the way that I think it's helpful to think about it is that you are having normal reactions to an abnormal event. You know, you have had an absolute bombshell come into your life and into your family when you get a diagnosis. And some people think of it as almost like several bombshells, because you get a diagnosis, you might get a treatment not working, you might get some sort of relapse, you might get news of a poor prognosis. The escalation of this illness can be very quick, and for some people a lot quicker than maybe they had expected it to be. So you can have a whole range of different emotions with that bomb, and all of that is a normal reaction to an abnormal event. That's a really, really helpful way of thinking of it. Normal reaction to an abnormal event, including one of the normal reactions is to feel very numb and disconnected, like you don't really feel anything at all. So as I'm talking about emotion, you might be thinking, well, that's not me, I don't feel emotion. But that's very common as well. So that's my first number 1 tip. Don't fight the emotions, they're really normal. My second tip is that difficult feelings can sit with good feelings. It's not a black and white thing. So feeling something really difficult and negative doesn't mean you can't feel something good as well. So I regularly hear people say things like, I shouldn't feel that way. I shouldn't feel resentment because I love my dad. Or, you know, I ought to feel glad to be providing this care because she's been so good to me. And I really think you need to be careful with the power of the shoulds and the oughts. You know, the word should and the word ought. They can be sort of prescriptive ideas of how you should be thinking and feeling that can really be unhelpful for you. And some of the patients that I see are sometimes in a better psychological place than their relative, because the relative is carrying a lot of guilt that they're not thinking or feeling in the right way. And you've got enough to be living without that as well. This can be really hard when family members feel differently. And it's hard sometimes for you to look at maybe, I don't know, your siblings, your children, and they seem very relaxed about something and you're struggling with things. But what we feel and what we think is really complex. And if we try to change the way that other people in our families feel, we often waste an awful lot of energy, actually. You know, a lot of people come to me as a therapist and say, you know, if only my sister felt like me. And it's almost that the wrong person's come for therapy, because it's very difficult for me to help that person to change how the sister feels. We can only work with kind of how we feel. So if some of this is resonating with you, I really want to encourage you to give up that particular fight. Difficult feelings can sit with good feelings, and it's very complex why people feel the way that they do. So give up this fight. My final tip is to focus on what you can change and not what you can't. So one of the most common feelings I hear from relatives is a sense of kind of helplessness. So they often describe sort of a sense of being out of control because you're not able to fix things. You're not able to do the one things that you know, really want to do, which is to make the cancer go away or turn back time so it never happened. And I often work with families to help them differentiate what is outside their control, a cure for cancer, or magic time travel, or the side effects of treatment, or some of the stupid, strange things that people might say to you. We can't change any of that. But there are things that are within our control, within your control. And differentiating between what's outside your control and what's within your control really is the path to sanity. The problem is that sometimes the things that are outside your control feel so big, they lead you to that helpless feeling that you can't do anything that's making a difference. But working out what is within your control can be a much better home for your time and energy. And from what I know about family carers, your energy is in short supply because you have a full-on task. So what I would really like you to think about after today, I mean, as Jenna said earlier, I'm not able to, you know, I'm not giving you individual therapy here, but one thing I would really encourage you to think about after today is maybe even make a list of things that feel within your control that you may be able to make some changes to make yourself feel better if you're finding it hard at the moment. And I'm just going to give you 3 little examples from my practice. So a woman, I'm going to call her Sue. She had a very full-on caring responsibility, and she used to settle her husband down in the evening about 8:30, 9 o'clock. He used to go to bed quite early because of the fatigue. And she was always really tired, but she used to have what she used to call a golden hour. So she had an hour from when he went to bed to when she went to bed. And that was only an hour every night, but it was so valuable to her. She used to think ahead of time, you know, what am I going to do tonight? Even if it's simple things like, what am I going to watch on television? And what am I going to prepare for my supper? Really small things. But actually, it was so valuable to her. And when it looked like it was going to be threatened and her husband was talking about maybe changing his routine and trying to stay up later or whatever, she was like, no, this is just my golden hour. It was so important to her. So how she used that golden hour was really within her control. I'm going to give you a second example, which is a guy that I worked with who I'm going to call Pete. And he had always been very into current affairs and politics and all of this, and you know, certainly in the UK there's a lot of negativity around that at the moment, and he decided that he was going to take control of how much he exposed himself to negative information. So he decided to stop watching documentaries. He stopped getting his daily paper because he felt that he had so much to cope with as a family carer that was difficult. His real life was difficult. He didn't want to have any more exposure to difficult things. He watched more comedies You know, he did more things to chill out, but he deliberately switched the TV news off and didn't engage with that. And that was his way of controlling how much negative stuff was coming into his head. And then the final example I'm going to give you is Lucy. And Lucy was incredibly house proud, but she felt that actually since she had become a carer, that was getting very difficult. And she decided to make some changes to what she felt was important. So she did something that she never thought she could do before, which was that she got somebody in to do her ironing, because she always thought nobody could do the ironing as good as I could. But she actually realized that she was spending more time doing the ironing when she could have been with her loved one. And this was really big for her. But actually it was very, very empowering. So she let go of some of her standards and delegated the ironing job to somebody else. Other common areas for control include doing things like campaigning work, advocacy, fundraising, running support groups, being involved in groups like this, working on forums. And they are big ways of having more control, and they really work for a lot of people. And I think they're great. But if they're not really for you, think of the very small everyday ways that you can control things within your life and make things right and better for you. So I'm going to move on now to another section of my talk where I'm going to talk about talking. And there are a few reasons that I want to talk about this. How we communicate with each other is at the heart of being in a relationship with someone. We can't really think about what it means to be in a relationship without thinking about how we communicate, even if that's difficult. Communication problems are by far the most common reason that people seek couple or family counselling. Time and time again, the research will say that is the #1 reason that people come to see somebody like me. It's because of communication problems. Another reason it's important for me to talk to you about this today is that talking about cancer, whether an illness is not curable or whether you're getting towards the end phase of a cancer journey and somebody's facing the end of their life, these are the most difficult things that we ever have to talk about. And while there is some cultural and age-based variations, I still often meet people who say that their friends and family really don't know what is going on because it's so difficult to talk about. Remember my ripples in a pond thing? You know, only the inner circle may know the full details of prognosis or how soon end of life may come. So I felt it was important to talk about talking with you today. And I'm going to cover 2 areas of communication now. I'm going to talk about you talking with the person with cancer and talking between you and other family members. Okay, so talking within families. So this is the conversations that go on between you and the person you care for. So I often work with that dyad. I often work with that couple. Often they come because they have difficulties talking to each other. But they also often have a real sadness that they should, that's one of those shoulds, be coming together more closely than ever. So they should be able to talk better now than maybe they did in the whole of their relationship. And I find it helpful to think of it as being on the same journey, but sometimes feeling like you're on different paths. And I think some of your other speakers maybe have used that kind of journey metaphor with you as well. Only the other day, I was speaking to a woman whose partner was in a hospice, and they felt that they'd faced the cancer journey together. They'd been very much on the same path. And she felt that now things had diverged, that she felt that he had not only moved away physically because he'd moved into a hospice, but that he was thinking and feeling things that were a million miles from the path that she was on. Now, I think this is really normal, and it isn't a sign that you or them have done anything wrong. The different paths does not equate to a deficit in one or other of you. And it's really important to emphasize that, but I do accept that that is really hard when you have felt that you've been on that journey together and you desperately want to be on the same path, and you can feel very lonely. It's definitely possible to feel lonely even when you're in a loving connection with the person with cancer. And sometimes it's hard to understand why somebody is experiencing things so differently from you, why they're on a different path. And you know, one of the factors is personality. I think when I ask people about what their communication was like pre-diagnosis, then it can give you some hints as to why somebody is behaving the way they are now in terms of communication. So, you know, an example would be somebody who'd been very quiet and passive and very chilled out and very relaxed is unlikely to become the patient who is very demanding and challenging when they're with doctors. Even though illness changes a lot of things, we still often behave in a way that fits with our pre-diagnosis behavior. And it's worth kind of remembering that there's not a kind of one style of persona for how somebody with cancer, you know, behaves. I don't know if anyone's familiar with the psychiatrist Irvin Yalom, but Yalom has written some really good information. I mean, he's got a book that it's aimed at psychotherapists and psychoanalysts, but it's around facing death and end of life. And some people, you know, may find some of his thoughts helpful. The one quote that I wanted to give you today was, "Every person must choose how much truth he can stand." I'll say that again. Every person must choose how much truth he can stand. And I come back to that idea quite often with family members, where they think that there is a way of processing what's going on that they wish that their loved one could be on the same page with them about. And I don't think that's the case. I think there is too much variation, and it's very hard when you can stand more truth than somebody else, and they're not able to be on that page with you. There's also different coping styles and what we would call in psychology defense mechanisms, which are the things that we use to deal with the difficult times. And it can be really difficult when it feels like somebody has retreated into a coping style or a defense mechanism, which means that they've sort of withdrawn from you. But actually, it's really, really common. And I see a lot of people where one of them has taken a particular role in coping with the illness that is different from the other person. So I often hear people say something like, "I think I do all the worrying for both of us." Or, "I get a lot of comfort from researching and campaigning, and he would feel better if he could join me." So you see what's happening there is that the relative has got a way of coping and managing, and they just wish they could get their loved one on board. One of the reasons that people feel that they should be on the same page is when they feel that the cancer has changed their loved one's personality, or that depression that some people with cancer experience make it feel like you're in a relationship with a different person. And I hear that quite a lot, like, "I don't recognize them now. You know, cancer has changed them so much." Sometimes loved ones cope in a way that you thought they would, but sometimes it's not. It's very, very different. Maybe you thought you would always be talking about things, and they have retreated into themselves. And certainly when I work in a hospice setting, there are a lot of people who have stopped having as open conversations as maybe they were earlier in an illness. But sometimes it can go the other way as well, where some people have that need to have conversations towards the end of their life. So again, we've got variation there. But I think it's important not to make this too black and white and have, you know, a group of people who are talkers and a group of people who are not talkers. I think it's more complex than that. I think when you actually look at what's difficult in talking, there's often things that are okay subjects, and then there's other stuff that's off limits and it's difficult to talk about. And what I would encourage you to do as a relative is, if you feel that certain subjects are really off limits with the person that you love, the person that you're caring for, is to find other people that you can have those conversations with. And we'll talk in a few minutes a bit more about that. So I'm just going to return to a few things that might help if you're trying to have conversations with the person who is affected by the cancer. And one of the things that can be helpful is to try to externalize the idea of cancer from the relationship. So I have a number of clients who talk about the cancer as if it's a thing, you know, so that they, or it, you know, they have a way of talking about it or the thing. Some people give it a funny shorthand name that, you know, the strangest one I've ever heard was somebody using a name of a vegetable, but it was just like, that was their little way in their family of, I won't say what vegetable it was, but you know, that was their way in their family of talking about the cancer. And if you're a sort of family who use humor, you may not be, but actually that can be kind of something that, you know, works. And if you've got children in your family as well, and they are aware of the cancer, then that can be something that can be a way of talking to a child. If you're able to talk about cancer as a thing which is outside of your relationship, it can be, psychologically, it can be really helpful, because it can be easier to blame the thing, cancer, when your relative says something that upsets you or seems to be very out of character. Some people find a lot of comfort out of saying, it's not John talking, it's the cancer, or the tumour, you know. It can also help with the sense that you're burdening the other people with your feelings. So you can both blame the thing for how you're feeling rather than blaming the other person. Now, this may be a really kind of unusual idea for you, this idea of kind of trying to externalize the cancer so it doesn't feel it's sort of taking over your relationship. But it is something that you can practice trying to talk like that and see how that works for you. You may find it useful. One intervention that I make when I'm working with families is to work out, so I'm going back to this idea that it's not black and white, talking and not talking, is, you know, looking at what you can talk about. One of the interventions I often use with families is to work out what time frame is easier to talk about. Is it the past, is it the present, or is it the future? Now this varies a lot. So if you can work out what works for your loved one, you can then have a way into having the conversations with each other. So an example here is I recently worked with a couple in their late 70s, early 80s, who got very upset talking about the future. So they totally shut down with each other, apart from little day-to-day exchanges about their current lives. But they were very superficial. They'd really shut down because the future was too scary. Asking about their relationship history, though, and their lives showed that they were able to talk, laugh, share experiences if we talked about their past. You know, they'd been married for a very long time. Other families find the past too difficult, especially if it reminds them too much and too painfully of what they've lost and how the relationship has changed, but are able to talk about how they think and feel today. So conversations like, you know, how was that medical appointment for you? How did you feel that went? You know, what am I worried about in terms of that medical appointment? You know, keeping it in the here and now is something that they can do, but they, you know, maybe can't do future or past. Some people actually in relationships don't have a problem talking about the cancer. They actually have the opposite problem. It fills all of their talk and overwhelms their whole relationship. And, you know, maybe that's more where you are. And if you are, then I have a few ideas of things that can help. I think it's useful to start by agreeing with your loved one that you have a commitment to try and find some time where you don't talk about cancer, illness, doctor's appointments, and that's really important and really good for your relationship. And there's various ways that you can do that. Some people use the mental trick, and it's a kind of cognitive thing that can be really work really well, is that they have dedicated time where they do talk about those things, and then they give it a structure so that they're going to talk about it for an hour, or they're going to talk about it when they're walking the dogs and that lasts 40 minutes or whatever. And then they purposely do something else. So when we go home, we ring our children, or when we go home, we do some errand or whatever. You can give it a routine so that your head is in a space that this is when and where you do the talking. And cognitively that can really work, because if you're scheduling when you are going to talk about things, it's easier for the brain to cope with time when you're not talking about it. So I'm going to give you some examples from my caseload, and some of these you're going to instinctively think, I wouldn't do that. But as I said at the start of the talk, not everything's going to land with everybody. So the first one is that some people have conversations about health stuff in bed in the morning. And they feel that they have a physical closeness if you're still sleeping in the same bed as your partner, as your loved one. So they have the physical closeness of each other, even if what they're talking about is really hard. And you're not responding to me, but I can see some of you probably would recoil at that, because yeah, it's not for everybody. Second example, talking in the car or when going for a walk or gardening. And some people like that because it's not intense eye contact. It's just you're in parallel doing an activity, and that can be freeing for some people. Quite a lot of people I know ban talking about health stuff after a certain time at night, because fatigue, it can be a massive problem. And if it's worse in the evenings, or it will lead to a restless night and will disturb your sleep more, to have a curfew and say we don't have difficult conversations after 8 o'clock, even if you need to really be really clever in how you distract yourself. So, you always watch film after 8 o'clock or whatever, so you've got some stimulation. Some people talk at the dinner table. And again, I can see some of you would probably recall from that, because, it wouldn't be what I would choose personally. But some people like the routine of, we have a conversation here, and this is where we have our conversations, and then we stop. And I even worked with a couple who had 2 designated rocking chairs with blankets, which was quite nice. So you could cwtch and cuddle in. Sorry, cwtch is a Welsh word. It means cuddle. Cuddle up, be nice and warm and cozy. And they went to these rocking chairs for their health chats. So there was one place in the house where they went to and they talked about the difficult things. So there may be some conversation, in spite of all that kind of, things that might help, there may still be conversations that are too difficult for you to have with the person that you love that has cancer. And I really want to encourage you to not put too much pressure on yourself if you can't make those conversations work, if it's too difficult, if it's too painful. But I would really encourage you to then seek out other people that you can have those conversations with. It's not a failure of your relationship that you can't talk about everything. Very few people can. So I'm going to move on in the final section of my talk to talk about talking with other family members and friends, and how you can do that and how it can be helpful. So there are so many benefits to talking that I almost don't know where to start. I'm in the communication business. I believe very strongly in we should talk to each other. But I'll give you some particular benefits to you as a family relative of somebody with pancreatic cancer, having benefit of talking to other people. The first thing is it stops things being trapped in your head. If you're somebody who tends to ruminate, there's really good evidence that actually getting things out can help that rumination process. There's a benefit of offloading. Some people call it catharsis, just a benefit of getting out there, even if nothing changes. So some of you may be able to relate, I know I can, to having a good cry. And nothing has changed in the situation afterwards, but you just feel better. There's some relief in doing that. You feel lighter. Another benefit is you might actually start to think differently about your situation through the act of talking. And I've got a bit of a theory that the world is divided. I've got no evidence of this, but I've got a theory that the world's divided into 2 types of people. People who think things through in their head and then only speak when they've worked it out. And others who think through talking. And I don't know which one you are. I don't know which one your partner or your loved one is. But if you're somebody who needs to think through talking and you don't allow yourself to do that, then you're not going to work things out. So you need to find a way to do that. Other benefits. Other people may have good ideas. Other people may have experiences that they can share. I mean, that's the wonderful thing about forums like this. Yeah, I mean, I'm probably preaching to the converted, because you've obviously, by reaching out to a forum like this, you see some benefits in that. But even though we all think those things are good ideas, we believe in talking, sometimes it can feel that there's a bit of a drawbridge has been pulled up, and you can feel that there is a distance between you and other family members or friends. And maybe you've pulled up the drawbridge, or maybe they have, but you're aware that there is distance. And you'll recall that earlier in my talk, I mentioned, I talked about loneliness within a couple. And there can be loneliness and isolation between you and those further ripples in the pond, so the extended family and friends. And many people talk about becoming more withdrawn from wider networks. And I think partly that's often because of practical reasons, because the limitations of a serious illness, you're not so out in the world. But also I think there's a psychological isolation where you can feel that no one quite understands what you were going through. And I know a lot of people talk about they feel very distant from everyday conversation about work, chit chat, office politics, social stuff. It seems trivial compared to what you are living with. And therefore you can feel there's a distance when you hear people going on about these things. But I've also heard people say the exact opposite, that sometimes friends come around and they say, oh, I don't want to bother you with my day-to-day stuff, when actually what you really crave is to hear conversations that aren't just about cancer and the difficult stuff you're living with. So ordinary everyday stuff that is going on in somebody else's life might be actually what you really need. And, you know, if you feel like that, to be able to say that to your extended family and friends. The friends and family may feel uncomfortable talking about illness. And, you know, that's just a fact that some people will struggle with what to say. And you do hear that, don't you, quite often, you know, I didn't know what to say. And, you know, I can someone like me can give advice to people in that situation about what to say. But we know that actually does put people off. The worry about getting it wrong, saying the wrong thing, upsetting you, all of that sort of thing can mean that they feel that they can't approach you. So unfortunately, I've come to the conclusion that in a way, it becomes more important for you to reach out to them. If you, I mean, I know you've got a lot to do anyway, but, you know, if you want to have more connection with extended family and friends in this situation, I think you've got to help them to help you. And that's a phrase that I use quite often in my work, help them to help you. Because mostly a lot of people want to be helpful, they want to do something, but they're not sure what to do. And in terms of talking to people, talking to these extended family and friends, I think it's useful to think about different types of talking and what you want out of a conversation, because that will help you to work out who you're going to talk to and what you want. So, you know, a silly example would be, you know, you don't want to pour out all of your troubles and all of your emotions to your next door neighbour. But actually, you might want to say to them, you know, it looks like you're going shopping. Can you get me some milk? And you want to be able to have that sort of relationship where you can ask them to do that, and not feel that that's an imposition and that you can't do that. But you wouldn't be expecting to pour your heart out to them. If you can think about what you want to get out of talking to people, you're more likely to get your needs met, and they're more likely to feel they've helped you. So lots of conversations seem to go wrong when people are on different wavelengths about that. So a common example would be, if I wanted to talk about my feelings, I really want you to hear me, I want you to understand, I maybe want to have a good moan about things. And that's okay, unless what you think I'm wanting is I want you to fix it, and I want you to make things better for me, or I want you to run an errand for me. So you then offer that, you offer to get me a pint of milk, and I say no, and I feel hurt because I feel you've not really listened, because I wanted to be listened to, and you feel rejected because I said no to your errand. So we end up further apart through that conversation. A lot of extended families say they want to do something. They want to do something to help, but they don't know what they can do. So unfortunately, they often go back to generic ways of asking for things like, can I do anything to help? Or call me if you need anything. But the problem with that is that it's too general, and chances are you won't call them. because, you know, you don't feel that you can. Maybe you don't even have time to call them. And then the people who've made the offers think that there's no point offering because you've not taken them up on the offer. And again, you've ended up further apart because of kind of missing each other in your communication. So I think my advice to you about this is to try to say yes as much as possible to offers, but try to help them to help you by being specific. Then you get lots of benefits because you get the thing done that you want and you keep the connection with the person and they feel they've been helpful to you and they're not helpless. Remember, we talked about helplessness earlier. So it stops you getting stuck in a really weird situation where you're feeling lonely and isolated. They want to help you, but there's just such a gap between you and how you can actually kind of bridge that. So I'm not sure if you can see me doing these strange hand signals. I hope you can. Jenna knows I wave my hands around a lot and I'm trying not to do it too much today. So I'm just going to give you a couple of slightly funny examples of where people have missed each other. So I know somebody said that they had had a family relative bringing them a fish pie every week for months. The problem was they're vegetarian. But after 2 weeks of accepting the fish pie, it became harder and harder and harder. You see where I'm going with that? To actually say, thank you, but that's not going to work for me. I had another person talk about a family member who used to bring over a load of magazines for them every week, but they had real problems with their eyesight and the print was far too small. They just could not read these magazines. But again, once they said thank you very much, it was really hard to then backpedal and say this isn't going to work. And I even had somebody say to me recently that, you know, somebody in their household always runs a bath for them. They say, oh, chill out, have a bath. And actually they hate baths, because they actually feel they get hot and sweaty and they really want a nice refreshing shower, but they don't want to reject the person who runs the bath, you know? So you can see how in all those day-to-day examples, you're just missing each other because you're not being able to kind of say what you need. All of those examples totally true. You know what you need. You're the primary caregiver. You know what you need and you know what you can ask for. And it might be a listening ear, it might be an errand, it might be you want to talk something through. One of the things about being realistic and managing your expectations is thinking about who is the right person for you for different things that you might need. So if your relationship with your sister has always been very distant and you've never been close, then the fact that you're now caring for your partner with cancer is maybe not going to change that. And your sister is not going to become your close confidant. And again, don't pressure yourself by thinking it should be that we become really close now, because it may well be that she's not the person to do that for you, when it may well be somebody else. The harsh reality is that family members who are at the outer circles of the stone in the pond will never fully understand your life and what it is to care with somebody with pancreatic cancer as you do. Sometimes people draw on their own experiences, but of course they may be different. So, you know, you may be caring for your 60-year-old husband, you know, and they say, oh, I know what you're going through because mine, you know, I cared for my mother when she was 98, you know, and you think, no, that's a different experience. But that's what we do as human beings. We draw on our own experience. And if we want them to understand, if we want that relative or friend to understand, we have to let them in. We have to let them in. By that means sharing what's going on for us. And that's the challenge that I'm giving to you today, that in order to tackle some feelings of loneliness and isolation that you may have, you need to let these people in. So I'm just coming to the end of what I wanted to tell you today. I also wanted to encourage you to not rule out talking to professionals. So family counselling may be very helpful. If you want to be able to talk better with people in your family but are finding it difficult, and don't think of, I don't know what experience people have had with counselling, but don't think this is something that you have to do over several months. You know, a one-off meeting with a family psychologist, a family counsellor can be massively empowering. I mean, just the being in a room with somebody who notices patterns that you get into and can ask good questions, it can really shift things. And if your family member won't come for counselling, then don't rule out the benefit of coming by yourself, because some people were really surprised at this, but by you coming and talking about your relationship and going home and being different because of the result of your counselling, it changes the relationship. It's what we call a family system, and that system is changed. So if you can't get your loved one there, then you can still benefit from some help. Then, you know, please do that. But again, don't pressurize yourself. Some people, it's not the right time. Some people rush to counselling after diagnosis, and there's so much going on. That may well not be the time for you to do that. So do it at the place when you've got time and energy. So I'm going to stop in a minute because I've probably overrun my slot. I usually do. I've talked a lot, and there's so many other things we could have talked about as well. I'm aware of that, but I just want to leave you with a couple of messages that I think were, for me, the most important things I wanted to say to you today. The first one is that there is no right way or wrong way to be in a relationship with someone you love who has cancer. So please let go of those shoulds and oughts. They're energy sapping and they're best avoided, and your energy is limited, so use it wisely. And also, it is so good to talk, and even though talking is hard and it's painful, it is so much better than feeling that you're alone with your thoughts in your head. And hopefully I've given you some ideas today about different ways of talking that are not just black and white. So just to sum up, I hope you've recognised yourself in some of the experiences that I've mentioned today, and maybe recognised other people in your family as well, and maybe, you know, feel that you can go away and maybe have a different conversation with somebody as a result of this talk today. And please take very good care of yourselves and each other through this forum. What they're doing with this charity is massively important, and just don't underestimate the power of just sharing experiences, because that's the sort of thing that can keep you really sane.